So some other ways to cope emotionally. The slide that says, "Today I am grateful for." This I like because practicing gratitude is such a powerful way to cope with problems in your life. When you're dealing with really serious illness like cancer, it's very scary, and it can be very easy to get caught up into everything that's going wrong and to focus on all of the negative parts of how cancer is impacting your life. But when we're able to sit back and really look at, what am I grateful for? What is going well in my life? What am I proud of in my life right now? And looking also at, what do I have to look forward to? These are powerful things that can help shift perspective. So the problems don't go away, but how you perceive the problem can change. And so, I encourage folks to really pay attention to gratitude and to practice gratitude in their life. And that may be easier for some than others. And so it takes some practice. And, ways to do that is, through writing or journaling. Sometimes people really connect gratitude also to their spirituality or to their faiths, finding ways to nurture that. And it may just be kind of at the end of the day or when you wake up, just take some moments and sit and think about the things that you're grateful for. And this other quote I also really like, and it's by Brené Brown. And if you're not familiar with her, she's a really great researcher and social worker who does a lot of writing on vulnerability and the gifts of imperfection, and about being kind to yourself and cherishing yourself. So she's a good writer, and she does a good TED Talk on some of this as well. But this quote that says, "Talk to yourself like you would to someone you love," I feel like this was said for caregivers, because so much of what you do is to talk kindly and gently and supportively to the person that you're caring for. And you need to do that to yourself. It's, again, when you're feeling overwhelmed and stressed, you sometimes focus on the things that are going wrong and you internalize those things. So practice some self-love, some gentleness, talking to yourself in positive ways. So I'm just going to kind of briefly talk about this next one. So cognitive behavioral therapy. This is an evidence-based therapy approach, and there's lots of information out there. There's a lot of self-taught interventions with cognitive behavioral therapy that you can look into. It's oftentimes used in psychotherapy with clinicians kind of guiding you through some of this stuff. But basically, the idea behind cognitive behavioral therapy is that our thoughts and our feelings and our behavior are all connected. So when you're intervening on one level, that it's going to have a ripple effect and change some other things. And so it's empirically supported to treat a wide range of clinical problems that include some of these listed here: anxiety, insomnia, depression, eating disorders, and chronic pain. And I put this up here for caregivers because so much of a lot of the things that caregivers are experiencing are related to stress, are related to worry, and we get stuck in that process. And so this is an intervention that can kind of help reframe and restructure maybe some of the thoughts that you're having. Just because I have the thought doesn't make it real, kind of testing out, is there another way to look at this problem? So some things like that. And if you're interested, I can give you some resources or some professionals also who provide this type of therapy for your own use. Also, so some healthy coping we talked a little bit about relaxation and the importance of that. And JamesCare for Life does classes with relaxation and mindfulness and some meditation. And also OSU Integrative Medicine, the website is there. They have a lot of great resources online that can kind of guide you through guided imagery and just some mindfulness practices. So that's something to pay attention to as well. And also James Psychosocial Oncology. So that is the department at the James that provides counseling and support to cancer patients and their families that are having a difficult time coping with the challenges and the impact that cancer is having on their life. So if you feel like you need some additional professional support, well, we have a department here for that.